Bismillahirrahmanirrahim. Quote of the day. There are two ways to live a pleasant life, either in someone's heart or in someone's prayers. Imam Ali alayhi salam. I am Dr. Ahmad Wahid Khan, PGR MPH Community Medicine Department, King Edward Medical University. My supervisor is Professor Dr. Saira Afzal, Chairperson and HOD of Community Medicine Department, King Edward Medical University, Lahore. Today, my topic of presentation is snake bite. Learning outlines, introduction of snake bite, types of snake bites, mechanism of venom action, preventive measure for snake bite, treatment of venom, recent updates, and MCQs. Learning objective. At the end of this presentation, participants will be able to describe about the snake bite, types of snake bite venoms, its prevention along with treatment. Introduction of a snake bite. Snake bite. A snake bite is an injury caused by the bite of a snake, especially a venomous snake. A common sign of a bite from a venomous snake is the presence of two puncture wounds from the animal's fang. Sometimes venom injection from the bite may occur. This may result in redness, swelling, and severe pain at the area, which may take up to an hour to appear. Snakebite envenoming. Snakebite envenoming is a potentially life-threatening disease caused by toxin in the bite of a venomous snake. Envenoming can also be caused by having a venom sprayed into the eyes by certain species of snake that have the ability to spit venom as a defense measure. Epidemiology. Available data show 4.5 to 5.4 million people get bitten by snake annually. Of this, 1.8 to 2.7 million develop clinical illness and 81,000 to 1,38,000 die from complication. It is estimated that at least 81,000 to 1,38,000 people die each year from snake bites. High risk people, high risk groups include rural agriculture workers, herders, fishermen, hunters, working children, people living in poorly constructed houses, and those with limited access to education and healthcare. Morbidity and mortality occur most frequently among young people, and children suffer higher case fatality. Women experience increased barriers to accessing medical care in some culture, and pregnant women are extremely vulnerable. An ongoing crisis restricted access to safe, effective anti-venom treatment in many regions, and particularly sub-Saharan Africa is one factor that contribute to the predisposition for seeking help through traditional medicine. Types of snake bites. There are two types of snake bites. Number one is dry bites, and number two is venomous bite. Bites, these occur when a snake does not release any venom with its bite. Venomous bite, these are much more dangerous. They occur when a snake transmits venom during a bite. Types of venom. Venoms are cytotoxins cause swelling and tissue damage wherever you have been bitten. Hemorrhages disrupt the blood vessels. Anti-clotting agent prevent blood from clotting. Neurotoxin cause paralysis or other damage to the nervous system. Myotoxin breaks down the muscles. Poisonous snake. Poisonous snake voluntarily emit venom when they bite. They can control the amount of venom they discharge, and 50 to 70% of venomous snake bite result in envenoming or poisoning. Even with a less serious type of bite, every snake bite should be treated as a medical emergency unless you are absolutely sure that the bite came from a non-venomous snake. Any delay in treatment following a venomous snake bite could result in serious injury or, in the worst case scenario, death. Which snakes are venomous? There are two major group of venomous snakes. Elapid's cobra family, there are about 300 venomous species of Elapidia, including kraits, mambas, coral snakes, and sea snakes. King cobra is the longest venomous snake in the world. They have short fang in the front of the upper jaw and strike downward, followed by chewing. Their venom is mainly neurotoxic, but it can also harm body tissue or blood cells. If a cobra bites you, you can die from paralysis of heart and lungs very quickly after the bite. King cobra belong to the longest type of venomous snake. Vipers. There are more than 200 species of Viperidia, which include pit vipers like rattlesnakes, copperhead, water moccasin, or cottonmouth, and old world vipers. They have long, hollow, venomous fangs attached to movable bone in their upper jaw. They fold their fang back into their mouth when they are not in use. Coral type snakes are painless but deadly. Symptoms. Symptoms will differ depending on which type of bite it is. If you suffer a dry snake bite, you will likely just have swelling and redness around the area of the bite. But if you are bitten by a venomous snake, you will have more widespread symptoms, which commonly include bite marks on your skin. These can be puncture wound or smaller, less recognizable marks, sharp, throbbing, burning pain around the bite that you may not feel for a little while after the bite. Redness, swelling, and tissue damage or complete destruction in the area of the bite. Envenoming can cause severe paralysis that may prevent breathing, making immediate medical attention critical. People may also experience bleeding disorders that can lead to fatal hemorrhage or irreversible kidney failure. Severe local tissue destruction may also occur, which can lead to permanent disability and even limb amputation. Children are at high risk of severe effect due to lower body mass than adults. A few additional symptoms include difficulty speaking due to extreme tightness in the throat and swollen tongue. Young children may become very pale, constant cough, or a wheeze. Mechanism of action of spread of venom. Once the venom has been injected under the skin or into a muscle, it does not go directly into the bloodstream but travels around the body through lymphatic system. Preventive measure. Depending on where you live or choose to vacation, you may or may not have a hard time avoiding snake. But if you are going to be in a snake territory, there are some useful tips to avoid getting bitten. Always be careful where you put your hand and feet. Do not reach into unknown spaces and holes or underneath objects without first being sure a snake is not hiding underneath. Do not lie down or sit down in the area where there might be snake. Wear high top leather boots when walking through or working in the areas with dense vegetations. Do not attempt to capture, handle, or keep venomous snake. If you are going camping, take extra care around swamps and other places where snake typically live. If you come across a snake, slowly back away from it and avoid touching it. Treatment of venom. First aid. After a bite by a snake suspected of being venomous, follow these steps. Immediately move away from the area where the bite occurred. Remove anything tight from around the bitten part of the body to avoid harm if swelling occurs. Reassure the victim as most venomous snake bite does not cause immediate death. Immobilize the person completely and transport the person to a health facility as soon as possible. Applying pressure at the snake with the pressure bite may be suitable in some cases. Avoid traditional first aid method or herbal medicine. Paracetamol may be given for local pain. Vomiting may occur, so place the person on their left side in the recovery position. Closely monitor airway, breathing, and be ready to resuscitate if necessary. Do not do any of the following. Do not pick up the snake or try to trap it. Never handle a venomous snake, not even a dead one or its decapitated head. Do not wait for symptom to appear if bitten. Get medical help right away. Do not apply a tourniquet. Do not slash the wound with the knife or cut it in any way. Do not try to suck out the venom. Do not apply ice or immerse the wound in water. Do not drink alcohol as a painkiller. Do not take painkillers such as aspirin, brufen, and naproxen. Do not apply electric shock or folk therapies. Specific antidote and general measures. Number one, pit viper, anomination. There are two commercially available antivenom for rattlesnake envenomation, CroFab and Anavip. Depending on the severity of symptom, CroFab is administered in increment of 4 to 6 vial by slow intravenous drip in 250 to 500 ml normal saline. To enhance the safety of an antivenom, saline diluted antiserum, the test dose of 0.02 ml at about 2 centimeter from the bite. For more serious envenomation with marked local effect and systematic toxicity, e.g., hypotension or coagulopathy, higher dose and additional vial may be required. The dosing of Anavip is 10 vials by slow intravenous infusion over 60 minutes, initially followed by traditional 10 vials increments as needed for more serious envenomation or for progression of symptoms. Monitor vital sign and the blood coagulation profile. Type and cross match the blood. The adequacy of venom neutralization is indicated by improvement in symptoms and sign and the rate that swelling slows. As a precaution, person should stay in the hospital for at least 24 hours. Prophylactic antibiotics are not indicated after a rattlesnake bite. Number two, coral snake envenomation. Give 1 to 2 vial of specific antivenom as soon as possible. Pfizer no longer makes coral snake antivenom in the US and remaining supply are dwindling. Now it's time for recent updates. Nanotechnology in venom research trends and its application. Abstract. Nanotechnology is a cutting edge technology facilitating involvement, development, and viable effect on nanomedicine and nanoscience. Science. With the recent trends and developments in the nanotechnology, the scenarios of applied engineered nanomaterials in industrial application, biomedical research, drug delivery, disease diagnosis, antivenom activity, cancer treatment, and other fields have approved speedily. The potential for nanotechnology in venom research that is endless with original, innovative solicitation continuously being explored. Venom or animal toxin is a unique bioresource of different dynamic constituents, which have revealed significant and promising application in the medical science. The ongoing nanotechnology science is joined with emerging venom study and emulsion. These two distinctive areas should be known as venom nanotechnology. Recent development in venom nanotechnology, this impetus or intent is clearly articulated to treating chronic human disease by target specific competent delivery of drug or therapeutic molecules, augment drug solubility, enhance stability, reduce toxicity, bioavailability, and drug stability. In this chapter, a comprehensive overview to the utilization of venom nanomaterial based formulation on the treatment of different types of cancer and infectious diseases along with green synthesis nanoparticle as an antidote against snake venom for life saving was discussed. We also emphasize the need for future research for broad commercialization of nano based formulation in snake venom research aiming a positive impact on public health. This is number two article. Global mortality of snake bite and venoming between 1990 to 2020, 2019. Snake bite and venoming is an important cause of preventable death. The WHO set a goal to halve snake bite mortality by 2030. We use verbal autopsy and vital registration data to model the proportion of venomous animal death due to snakes by location, age, year, and sex, and applied these proportion to venomous animal contact mortality estimates from the Global Burden of Disease 2019 study. In 2019, 63,400 people, almost about 95% uncertainty interval, 38,900 to 78,600 people died globally from snakebite, which was equal to an age standardized mortality rate of zero point 0.8 death per 1 lakh and represent a 36% decrease in ASMR since 1990. India had the greatest number of deaths in 2019, equal to an ASMR of 4.0 per 1 lakh. We forecast mortality will continue to decline, but not sufficiently to meet WHO's goal. Improved data collection should be prioritized to help target intervention, improve burden estimation, and monitor progress. Now it's time for MCQ. MCQ number one. Ali is a resident of Balakot, a highly mountained area with lush green forest. He comes running to nearby clinic with a complaint of snake bite half an hour ago. Only few medicine are available at that clinic. If someone is bitten by the snake and doctor cannot get help right away, what first aid should be given? Keep the bite above the level of the hurt. B is clean the area with alcohol and water. C, applying the pressure at the bite side with a pressure pad may be suitable in some cases. D is ASD along with NSAIDs. E, apply electric shock or folk therapies. Anyone?
B.
B is not a correct option. It's C, applying pressure at the bite side. Now, question number two. Mr. Jones live in a North America where most snakes are not venomous, but those that are venomous includes the rattlesnake. Approximately 20% of the population there has a history of snake bite. What can you do to lower your risk for being bitten by a snake? A, catch any snake you see on a hike and move them off the trail. B, kill any snake you see on the hike. C, wear high top leather boots when walking through or walking in the area with dense vegetation. D, walk freely on the large grasses. E, lay down or sit down in the area where there might be snakes.
C.
Yes,
C.
the correct option is C. Question number three. Poisonous snake voluntarily emit venom when they bite. Once the venom has been injected under the skin or into a muscle, it travels around the body through which of the following systems? A is lymphatic system, B is arterial system, C is venomous system, D is portal system, and E is central nervous system.
C.
Alpha.
Itself, the venom spread through lymphatic system. Question number four. Mr. Asghar died in a village in Pakistan with a history of snake bite and or after he presented to a Mew hospital. The friend gives the history that the person is bitten by a big snake having short fang or upper jaw that was most likely cobra type. The death happened because of the failure of the which of the following system? A, cardiovascular system. B, respiratory system. C is renal system. D is neurological system. E is circulatory system.
E.
Yes, it's D, neurological system. Question number five. The ultimate treatment for a snake bite is antivenom. It is necessary to ask about the history of allergy and intradermal sensitivity before inoculation. To further enhance the safety of the antivenom saline diluted antiserum, the test dose is given as follow. A is 0.02 ml at the exact site of the bite. B is 0.02 ml at about 2 centimeter from the bite site. C is 0.05 ml at the exact site of bite. D is 1 ml is given intravenously and E is 3 ml is given intravenously. The correct answer is B 0.02 ml at about 2 centimeter from the bite. Question number 6. Aslam is the professional photographer. He claimed that he has seen a venomous snake type of snake more than 5 meter in the forest of Nigeria. A variety of snakes can be of large size. However, some snakes can also be as small as less than a foot. Which of the following is the longest venomous snake in the world? A is king cobra, B is black mamba, C is western taipan, D is rattlesnake, and E is anaconda.
E.
The correct option is A. King cobra is the longest venomous snake in the world. Question number 7. A person XYZ bitten by a venomous snake was admitted in a tertiary care hospital. Antivenom was administered to reduce the effect of poison in that person. Antivenom was given intravenously as a precaution. At least how much time should a physician advise a patient to stay in the hospital? A is 12 or B is 24 hours, C is 48 hours, D is 72 hours, and E is 3 hours. Yes, it's
C.
24 or V. Question number 8. ABC is a fisherman by profession. He got bitten by a poisonous type of snakes. After 2 days of treatment in the Mew hospital ward, his life was out of danger. However, debridement of the leg is required as further procedure. His coagulation profile shows PT about 29 and APTT about 47. The appropriate step taken is A is immediate debridement is done. B is wait for the next 3 days. C is wait till coagulation profile is normal. D is partial debridement is the best solution, and E is nothing to do. The correct option is C. Wait till the coagulation profile is normal. 9. A person while doing farming presented to home with a complaint of reddish lower leg swelling was also accompanied. He ignored it and slept after taking brufen tablet. His wife made him wake in the next morning, but there are no sign of life of that person. Different snake were found in his working area. Which of the following type of snake is painless but deadly? A is coral type, B is viper, C is copperhead type, D is cobra type, and E is pit viper. The correct answer is
D.
A coral type. Question number 10. A farmer came to a tertiary care hospital with a snake bite. He killed the snake. Doctor identified it as a rattlesnake. In hospital, CroFab antivenom is available. How to administrate it? Administrate 4 to 6 vials by slowly intravenously. Drip in 250 to 500 ml of normal saline. B. Give it intramuscularly. C is give 1 to 2 vials of specific antivenom as soon as possible. D is rattlesnake is not a poisonous snake, so no need to give any antivenom. Just monitor the patient. E give orally. Anyone? The correct answer is A. Administrate 4 to 6 vials by slowly intravenously drip in 250 to 500 ml of normal saline. This is the key of my MCQs. These are the references through which this presentation has been made. Please like our YouTube channel. Thank you.
Thank you very much. Very nice presentation, Dr. Hamad. It is Dr. Hamad actually